guys! Welcome back on my channel. And for today's video, I am going to perform about proper application of 10 emergency cases that we encountered in restaurants and hotels. So if you are interested to know, please watch this video. First emergency case is robbery. What would you do if you encountered robbery? Here are the things that you need to remember. First, follow what the robber says. Don't argue. Give the robber what they want. Tell them what you're going to do and why. Observe what the robber does so that you can include it on your report. Like if they have accomplice, and pay also attention on their conversation. Like they mention their nicknames or they mention some places. Make sure to feel secure before you call 911. Make mental note of the robber's appearance because you'll need it to describe the suspect when you filling your report. Take note their features, including height or what age are they. Second, nose bleeding. Here are the things that you need to do when you are nose bleeding. First, firmly pinch the entire soft part of the nose just above the nostril. Sit and lean forward. This will ensure that the blood and other secretions do not go down on your throat. Breathe through your mouth. Hold this position for 5 minutes. If the bleeding continues, hold the position for an additional of 10 minutes. If bleeding does not stop, it's time to go to the emergency department. Third, drunk guest. How will you handle if you encounter intoxicated or drunk guest? First, stay calm. Don't argue with the intoxicated guest. Don't embarrass the guest, especially in front of other people. Invite the problem guest to an area away from other guests where you can talk. Deal the situation in a calm, friendly way. Speak the person directly and firmly explain that what they are doing is unacceptable. You can also offer them a coffee or any hot drinks to drink. And then, let your guest talk on what his or her problem, and you can listen and empathize with your guest. Acknowledge your guest's anger or frustration, but also remind them that they are in your residence or place. If you cannot calm the guest down or convince them to stop, ask a friend of theirs to stop. If it is out of your control, you can call a police for a rescue. If you decided to ask a person or the drunk guest to leave, remember that you are still responsible for their safety. If they have a car, ask them for the key. Don't let them to drive their own car. You can call a cab or get someone to drive them home. The next case incident is fire. Here are the things that you need to do when there is fire. First, act immediately but try to stay calm. Alert people in the area. Activate the fire alarm and don't waste time and guide the people to the exit. Do not attempt to extinguish a fire unless you are trained to do so. Leave it to the professional. Stay away immediately from the place and stay into a safe area. What will you do when you get wounds or laceration? First, rinse the wound with clear water for 5 minutes. Apply antibiotics after, and then cover the wounded area of Band-Aid. If you don't have Band-Aid at the moment, you can use clean clothes as an alternative. The next case is eye injury. Chemical burn and splashes on the eye. Don't close your eyes if that happened. Immediately flush the eye with plenty of clean water and seek emergency medical treatment immediately. The next incident case is first-degree burn. Immediately immerse the burn in tap cold water for 10 minutes or apply cold water compresses, not ice. Put petroleum jelly or aloe vera gel. Do not apply ointment, toothpaste, or butter to the burn. Cover the burn with a non-stick sterile bandage. The next case is sprain. What will you do when you get sprained? Ice the area for 15 to 20 minutes as soon as possible after the injury. Compress the area with elastic wrap or bandage. You can use clean clothes if you don't have elastic wrap at the moment. Fainting. If someone is standing when they faint, catch them and place gently on the floor. Call 911 for emergency rescue. Check the victim's breathing, pulse, and if anything lodged in the throat. And then, if the person stopped breathing and don't have pulse, start CPR. If her breathing is back, gently roll the person to his side. Stay with the person and monitor until medical personnel arrive. The next is choke. If you witness someone is choking, encourage them to cough, and if they can't, make them stand and bend the person forward. Hit her back with the heel of your hands between shoulder blades to dislodge the blockage. If the person are still choking, give 5 abdominal thrusts. Hold around the waist and pull inward and upward. Repeat the steps until they can breathe again and until the help arrive. That's all, and thank you for watching.